The American retirement system has a quiet assumption baked into it. Somebody at home will love you for free, a husband who drives you to the doctor, a wife who notices when the pills stop working, an adult kid who catches the scam before the money's gone. That unpaid labor holds the whole thing together, and every year, more Americans reach old age without any of it. About 16 million people over 65 now live alone. For them, the thing families usually provide has a price tag, and it's a big one. Solo aging isn't new, but the scale of it is. Go back to 1950, and only about 1 in 10 American adults lived by themselves. Old age happened inside families. You moved in with a daughter, or she moved in with you. 3 generations under one roof was ordinary, not a hardship. Then almost everything changed at once. People started living a lot longer, so the years at the end stretched out. Marriage rates fell. Gray divorce, splitting up after 60 became common. More people never had kids, and the ones who did had fewer of them, often scattered across the country for work. Add it all up, and you get a country where aging by yourself is no longer the exception. Today, roughly 1 in 3 Americans between 65 and 74 live alone. Past 75, it's closer to half. And because women outlive men and are less likely to remarry, this is mostly an older woman's story. There are more than 3 times as many widows as widowers. Here's why the money matters so much. The entire structure of long-term care in this country was built assuming a family caregiver would always be there, invisible, unpaid, and endlessly available. That assumption made the system cheap to design. When you age alone, the assumption breaks, and the bill lands on you. Start with income, because that's where solo aging bites first. 2 people retiring together get 2 Social Security checks. Social Security being the government retirement benefit you paid into your whole working life. One person gets 1 check. As of this year, the average retired worker collects about $2,080 a month, a little under $25,000 a year. That's it. That's the floor a lot of solo retirees are standing on. Now here's the trap. A couple splits the rent, the utilities, the property taxes, the car, the groceries bought in bulk. Living alone, you carry all of it on one income. Housing doesn't get half as cheap because there's half a person in the house. It barely moves. Then comes care, and this is where the numbers get serious. If you need help with daily life, bathing, dressing, cooking, getting to the bathroom, somebody has to provide it. In a marriage, a spouse often does that for nothing. Alone, you buy it. A home health aide, someone who comes to your house to help, runs around $33 to $34 an hour. Bring one in for a chunk of the day, and you're looking at a median of roughly $78,000 a year. Assisted living, an apartment with meals, staff, and help on hand, now runs about $6,200 a month. That's $74,000 a year. And a nursing home, a skilled nursing facility for people who need round-the-clock medical care, runs well past $100,000 a year for a shared room. A private room lands closer to $128,000. Put that against the average Social Security check of $25,000 a year, and the gap is almost cartoonish. The care costs 3 to 5 times the income. To make that real, a private nursing home room now runs more than a year at most private colleges. Except nobody saves 18 years for it, and nobody graduates. You just keep paying month after month for as long as you need the bed. For a married couple, one spouse can absorb some of that work at home. Alone, there's no one to absorb anything. Every hour of help is an hour you pay for. So where does all that money actually go? Follow it, and you start to see the shape of an industry built on top of people who have no one else. The single biggest number in this whole story never shows up on an invoice. Family caregivers, the spouses and kids and siblings doing the work for free, provided care worth more than $1 trillion in a recent year, according to AARP, more than $1 trillion. If that labor were a company, it would be one of the largest employers in the country. It's the hidden foundation the paid system sits on top of. Solo agers are the people who have to replace that free $1 trillion workforce with cash, and there's a whole market waiting for them. Assisted living and nursing homes are increasingly owned by big national chains, real estate investment trusts, and private equity firms, investors who buy the buildings and the operators to earn a return. Their model is straightforward. Keep the beds full, keep labor costs down, raise rates a little every year. When occupancy climbs, so do prices. Labor is the pressure point. The aides who do the actual hands-on work are among the lowest paid workers in the country, and turnover in the field runs somewhere between 40 and 60% a year. High turnover means less experienced staff, which chips away at the quality of what you're paying all that money for. Meanwhile, the person paying, often a solo ager with no family watching the books, has almost no leverage. There's also a referral business most people never notice. When you search online for a place to live, the free service that helps you find one is often paid a commission by the facility you end up choosing, sometimes worth a month or more of your rent. The advice isn't neutral. It's a sales channel dressed up as help. And as the same handful of companies buy up more and more of the buildings, there are fewer competitors left to keep any of them honest on price. Then there's the softer machinery, move-in fees, charges that climb every time your needs increase. A level for medication management, another level for memory care, long-term care insurance, sold years earlier as protection with premiums that can jump, and fine print that decides when it actually pays out. None of this is a scam exactly, it's just a system that runs on people who can't easily push back. And someone aging alone with no second set of eyes is the ideal customer. Now, the question almost everyone gets wrong. People assume Medicare covers this. It mostly doesn't. Medicare is the federal health insurance for people 65 and older. It's good at doctors, hospitals, surgery. But long-term help with daily living, the aid, the assisted living apartment, the months or years in a nursing home, Medicare almost entirely does not cover. It'll pay for a short skilled nursing stay after a hospital visit, up to about 100 days, and then it stops. The single most expensive part of aging is the part Medicare was never built to pay for. So who does pay? First, you do. Out of your own pocket, out of your savings, out of the house. You spend down what you have. When it's nearly gone, Medicaid steps in, and Medicare and Medicaid are not the same program. Medicaid is the joint state and federal program for people with very low income and almost no assets, and it's the largest payer of long-term care in the country. But to qualify, you generally have to be nearly broke, which means the way most Americans afford a nursing home is by first spending almost everything they own until they're poor enough for the government to take over. You'd think private insurance would fill this hole. Mostly it doesn't. Medigap, the extra policy that covers what Medicare leaves behind, is built for medical bills, not for years of custodial care. Medicare Advantage, the privately run version of Medicare, works much the same way. And long-term care insurance, the one product actually designed for this exact problem, has grown expensive and hard to buy, so only a small slice of people ever hold a policy when the day comes. For a married couple, the law softens that blow. There are rules that let the healthy spouse keep the house and some income, so one person doesn't end up destitute because the other got sick. Age alone, and there's no second person for those protections to shield. The spend down just runs all the way to the bottom, and the free labor gap sits underneath all of it. Someone with family has a daughter driving to appointments, a son managing the pills and the paperwork, a spouse catching the early confusion before it becomes a crisis. That work is worth over $20 an hour if you had to buy it, and tens of thousands a year in practice. The solo ager pays for every piece of it, or simply goes without. And going without has its own price. More falls, more hospital stays, faster decline. Beyond the sticker prices, solo aging carries a set of costs that never make the brochure. Start with the annual increases. Care prices have been climbing faster than general inflation. Assisted living jumped about 10% in a single recent year. When you sign on at $6,000 a month, that's the starting price, not the price you'll be paying 5 years in, on a fixed Social Security check that rises 2 or 3% a year. The math slowly turns against you. Then, the level of care creep. Assisted living quotes you a base rate, but the moment you need help with more tasks, the fees climb tier by tier. Memory care, the wing for people with dementia, costs more still, and an estimated 4 million older Americans aging alone already have some cognitive impairment, often with no one nearby to notice it starting. There's the cost of having no advocate. When you're alone in a hospital, there's no family member asking the second question, catching the wrong medication, pushing back on a bad discharge plan. That absence doesn't show up as a line item, but it shows up as worse outcomes and often more spending. There's also the cost of coordination itself. Somebody has to handle the money, sell the house, arrange the move, sign the contracts, keep track of the medications and the appointments. With family, that labor is free and mostly invisible. Alone, some solo agers end up hiring a professional to manage their affairs, or a court appoints a guardian, and a stranger starts billing the estate by the hour to run a life the person can no longer run on their own. And there's what happens to whatever you leave behind. When you die with debts and no spouse, those bills get settled out of your estate, everything you owned through probate, the court process that sorts out what's left. The house you hope to pass on can get sold to cover the final year of care. For a lot of solo agers, the whole point of a lifetime of saving quietly dissolves into the cost of the ending. Step back and the logic clicks into place. None of this is an accident. It's the predictable result of a choice the country made or never quite made out loud. America decided long-term care would be a private responsibility, not a public guarantee. Unlike most wealthy countries, there's no broad national program that simply covers old age care. The government's role was deliberately kept narrow. Medicare for medical treatment. Medicaid is a safety net only after you've spent nearly everything. The rest was left to families and the market. That design leaned hard on one assumption, that families would fill the gap for free. And for generations they did, mostly women, quietly absorbing $1 trillion of labor a year. Solo aging is what happens when that assumption stops holding for millions of people at once. Here's the part that should get your attention. The demographics are moving in exactly the wrong direction. By the 2030s, the majority of Americans over 80 are projected to be aging on their own. Around 10 million people, more elders, fewer children per family, more years of frailty. The unpaid workforce the whole system depends on is shrinking right as the need for it explodes. The bill that used to be paid in family labor is increasingly going to be paid in cash or not paid at all. So what does retiring alone in America actually cost? More than a number. It costs the free labor everyone else quietly receives. The retirement system works reasonably well if you arrive with a partner, some savings, and family nearby. Strip away the partner and the family, and you see what the system really is. A market that assumes someone will love you for free and charges full price when no one does. The solo ager pays twice. Once in dollars for the care a spouse might have given, and once in risk because there's no one watching when things go wrong. Nobody's hiding this, it's just built to run on unpaid devotion, and it doesn't have a good answer for the growing number of people who don't have any to draw on. The house, the savings, the whole life's work for a solo ager, that's often what stands between them and the floor. And the floor is a Medicaid bed you only reach after you've lost everything else. Growing old with someone is expensive. Growing old alone in America is a bill most people never see coming until there's no one there to help them read it. If breaking down the money behind aging in America is useful to you, give this one a like and subscribe. We follow the dollars through this system one piece at a time, and there's always more to untangle.